Thousands of students in Quebec returned to the classroom last week, and many more will follow across the country in the coming days. And besides notebooks and pencils, their school days may involve masks, cohorts, and a lot of added anxiety. To help students and parents prepare, we are joined now by Dr. Dina Kulik, a pediatrician and emergency room physician in Toronto, and Dr. Shimi Kang, a psychiatrist based in Vancouver. Thank you both so much for joining us. Our first viewer question comes from Nicole Moza, who asks, do my children have to stay home for 2 weeks every time they get a cold or flu symptoms to ensure it's not COVID-19? And do we as parents also have to miss work for a couple of weeks? So Dr. Kulik, let's start with you. Obviously the specific rules in that regard depend on your exact school board, but what's your advice?
I think the most conservative approach would be to stay home for the next 14 days. Anyone that's been exposed to that person who has illness. The reason why, for me, is that we know we're contagious for at least 2 weeks once we're unwell. And I think it's impossible at the moment to really know if your child's illness or your illness is in fact COVID or not, because the test is pretty imperfect. I'm not sure it's very reliable or accurate in young people especially. And so if you have a negative test, I still wouldn't be making decisions about return to school based on that negative test. Instead, I think the conservative right approach at the moment, so that we don't risk putting ourselves in a second wave, would be to stay home for the next 2 weeks.
Right. And Dr. Kang, over to you next. Any advice for parents on how to talk to their children about anxieties they might have when it comes to heading back to school?
Yes, and there's definitely anxiety in those kids who are going in person, but also remote learning. They're worried about being left behind academically and social isolation. Those going in person, of course, have safety concerns. So you want to have age-appropriate questions in the sense, and I always say start with being open and curious. So really just ask them what's on their mind. They may have anxieties about all kinds of things. So that's a great place to start. And then guide them towards some practical problem solving, some things that you may foresee, whether it's wearing masks or staying focused online, and then really build a community and start asking them and telling them that there are people that they can also turn to within their school environment so that they can communicate their emotional concerns.
Dr. Kulik, let's go to you for this next question that comes from Wendy McCarthy, particularly in the context where students may be required to wear masks when they return to the classroom. She's wondering if face shields will provide adequate protection.
We don't really know. There hasn't been any big studies that have shown that they're as effective or less effective. But the idea behind a mask is that it protects your sputum, your mucus, your droplets from leaving your body and going into the air to potentially affect other people. So if the face mask goes very low or the shield goes very low, theoretically you're a bit blocked. But what I've seen in my practice and even on the street is a lot of people are wearing face shields that don't go very low. They might only go to about here, or they're moving around, et cetera. So we don't really know the answer whether they're effective or not. When you're a child and you could wear a mask, that's what I would prefer because it's closer to your face. It's going to prevent more droplets from staying towards you versus going out into the air.
Right, good to know, and especially certainly a lot of parents wondering if it's even realistic to expect children, young children, to be wearing masks for long periods of time. Dr. Kang, over to you for this next question, and especially pertinent for students who will be doing remote learning or parents who just decide to keep their kids at home. How do you balance concerns for their physical health and COVID-19 with concerns about the impact that long-term isolation can have on their mental health?
Yes, and we're certainly seeing increased rates of loneliness. We know that in general, even before the pandemic, anxiety, social disconnection was an issue. So really making it a priority. If you're on remote learning, schedule it into your day, social connection. Prefer technology that has face and voice. So we need to see each other, hear each other's voices, and have that really scheduled like homework time where you're connecting with people in a meaningful way. We want social bonding, going deeper than just socializing. Really important for the tween and teen because their brains are more sensitive to feelings of isolation. So really, I know there's a lot to think about right now, and academics is part of it, but school is very important to keep those social connections and make that a priority.
And Dr. Kulik, last question to you, and a quick one, 30 seconds or less. This is a common one from grandparents who are now wondering, once their grandchildren return to school, should they keep their distance?
I would assume that if kids are going back to school, they're not only being exposed to 15 or 20 or more kids in their group, they are exposed to their people that are, bringing their own illnesses from their bubbles. They're the people that are higher risk, the grandparents. So I would be trying to keep the distance if you can.
And that's a heartbreaker, and unfortunately we'll have to leave it there. Dr. Dina Kulik, Dr. Shimi Kang, thank you both so much for joining us.